Welcome to the MD Edge Daily News for Wednesday, August 29th. I'm your host, Nick Andrews.
And I'm MD Edge editor Mary Ellen Schneider. Today, high-sensitivity cardiac troponin levels are linked to cardiovascular outcomes in COPD.
Also today, mindfulness training for migraine is just now beginning to gather steam.
And later, think negative chest x-ray to rule out pediatric pneumonia.
But we begin today with our continued coverage of the 2018 Annual Congress of the European Society of Cardiology. The worldwide cardiology community has a newly revised universal definition of a myocardial infarction, and it refines the way that cardiologists distinguish between infarction and injury. This is according to comments made at ESC 2018 by Dr. Joseph S. Albert, who was one of the two chairs of the panel that wrote the definitions. Dr. Albert says that there were three previous definitions, but there is still a lot of confusion about how to distinguish between injury and infarction. He also notes that he hopes that this fourth definition will further help people distinguish the two and help determine whether or not a patient indeed has an MI. Just days before ESC 2018, a task force released the fourth universal definition of myocardial infarction. The task force included European Society of Cardiology, the American College of Cardiology, the American Heart Association, and the World Heart Federation. The new revision includes 5 new concepts, 14 updated concepts, and 6 new sections since the third universal definition from 2012. According to Dr. Albert, the most important change might be the need to determine whether a rise in cardiac troponin, a key biomarker in cardiac damage, resulted from infarction or injury. He says that the new changes to making an MI diagnosis will likely help drive a couple of important changes in the way U.S. patients with suspected myocardial injury or infarction get assessed. You can read more about the new MI definition by clicking the link in the description.
High levels of high-sensitivity cardiac troponin are strongly associated with risk of poor cardiovascular outcomes for patients with COPD and heightened cardiovascular risk. This is according to a post-hoc analysis of a clinical trial published in the Journal of the American College of Cardiology. SUMMIT is a randomized trial that assesses inhaled corticosteroids and long-acting beta agonists in COPD patients with elevated cardiovascular risk. In the trial, researchers randomly assigned nearly 1,600 patients who had a baseline cardiac troponin 1 assessment and had a follow-up assessment at 3 months after randomization. Patients who were in the highest quintile of baseline plasma cardiac troponin concentrations had an increased risk of a cardiovascular composite event. Increased risk of cardiovascular death was also seen in the highest quintile, as compared with the lowest quintile. The researchers also report that there was no difference in risk of COPD exacerbations between the highest and lowest quintiles. Dr. Nicholas Mills is a researcher at the University of Edinburgh in Scotland. Dr. Mills says that recognizing the risk associated with increased troponin concentrations might encourage clinicians to address cardiovascular risk due to lifestyle choices, and make patients more likely to engage with these recommendations.
A brief course of mindfulness training proved to be as effective as prophylactic medication for chronic migraine patients in the 12 months after their withdrawal from overuse of acute migraine medications. This is according to data presented at the annual meeting of the American Headache Society in San Francisco. In the exploratory study, participants could opt for pharmacologic prophylaxis for migraine or a brief course of mindfulness training after withdrawal. The mindfulness training entailed 6 once-weekly sessions of 45 minutes, along with home practice for about 5 to 10 minutes per day. Dr. Frank Andrasik presented the data at the meeting. He says that while this study design doesn't rise to the status of Level 1 randomized trial evidence, it does reflect real-world clinical practice where patients often have a big say in choosing their treatment plan. The study included 44 participants who averaged more than 20 headache days per month, with more than 18 days of acute migraine medication use. Dr. Andrasik reports that patients in both groups experienced similar headache days per month at 3 and 6 months of follow-up, and both groups averaged similar 7 to 10 day reduction in days of acute migraine medication use per month. At 12 months, 65% of the mindfulness therapy group and a similar 74% of the preventative medication group no longer met diagnostic criteria for chronic migraine.
And finally today, from Pediatric News, a negative chest radiograph can be used to rule out the possibility of pneumonia in children suspected of having the condition, and therefore reduce antibiotic use. This is according to a paper published in the September issue of Pediatrics. In the study, researchers evaluated nearly 700 children who presented to the emergency department with suspected pneumonia. The researchers report that more than 72% of the children had negative chest radiographs. Of these, 44 were clinically diagnosed with pneumonia despite the radiograph results and prescribed antibiotics. The remaining 411 children with negative radiographs were not prescribed antibiotics. In this group, less than 2% were subsequently diagnosed with pneumonia within 2 weeks of the radiograph. These children were all under 3 years old, but none had been treated with intravenous fluids for dehydration. The researchers note that most clinicians who care for children in an outpatient setting rely on clinical signs and symptoms to determine whether to prescribe an antibiotic for the treatment of pneumonia. However, it appears that reliance on physical exams alone may lead to the overdiagnosis of pneumonia. And that concludes this edition of the MD Edge Daily News. You can find links to these stories in the podcast description. For MD Edge, I'm Mary Ellen Schneider.
And I'm Nick Andrews. The MD Edge SciCast is all new today. You can check out the SciCast at mdedge.com/psychiatry, and you can subscribe to the SciCast and the Daily News wherever podcasts are found.